Good morning. My name is David Knox, and I just came back from Guadalajara, Mexico. And by my voice, you can tell I am doing better. So, this video is going to go really concurrent with our podcast. If you listen to our podcast with Daisy and I on MSA Crusaders, you'll find us on any podcast app that you listen to, or you can even go and click on our app. If you don't want to download the apps, Spotify, iTunes, or anything the music or Android stuff, you can always do it. You listen to us through the browser, of your computer, your TV, anything you want. So you don't have to download apps to listen to us, but definitely check us out on MSA Crusaders. There we'll be going more personal about what's going on, opening questions for Daisy and I. But this video, I really wanted to talk about what I had specifically and how it's affected me. So I will be reading from a script to make this a little more clear and concise and trying to not make the video so long for you. So here we go. So we all know MSA. MSA is a disorder that affects many, is a neurodegenerative disorder that affects many parts of the body. And it slowly steals away a person's ability to control their movements, their balance, and even basic bodily functions like blood pressure and digestion, which we will talk about. So we're literally one day we wake up and we find it difficult to walk, to speak, and even to swallow. And unfortunately, this is the reality for many of us that have MSA every single day. Currently, of course, there is no cure for MSA, and treatments focus on only managing the symptoms. So it's just kind of like Parkinson's and MSA. It doesn't really matter which one we have because it's really only to treat the symptoms. The difference with Parkinson's, though, is that they have medication that they react to and doesn't make it terminal anymore. But MSA patients, we don't react to medicine. Very, very few of us. Therefore, it makes us a terminal disease. Today, I have highlighted a few promising areas of research that I went through that may lead to breakthroughs in treating the disease in the future. Maybe not in my lifetime, but definitely very soon. So the first thing I had, which I don't know, I'll have to upload pictures, but I had exosomes. I had exosomes. If I could find my pictures here, bear with me. I had, in Spanish, of course, it's 5 billion. So I imagine that's 5 billion of these exosome um, cells. So what these things are tiny bubbles released by cells, like a miniature messengers carrying vital cargo, right? They can travel throughout the body, delivering instructions and influencing the behavior of other cells. Now, researchers are harnessing the power of exosomes derived from a special type of stem cell called mesenchymal or MSC. These MSC-derived exosomes are shown incredible potential in preclinical studies. They can also reduce inflammation of the brain, protect neurons and from damage, and even promote growth of new neurons, which is very important to MSA patients, right? Parts of our body are dying, especially in the brain. If we can promote the growth, and even if we can't promote the growth, if we can delay the destruction, right, the damage, we live longer. We live better longer. Okay. So, speaking of MSCs, there are uh, the MSCs, the stem cells, are actually like superheroes in a cellular world, right? They have an amazing ability to transform into different cell types, making them incredibly valuable for regenerative medicine. In the context of MSA or multiple system atrophy, MSAs are being investigated for their ability to replace damaged cells in the brain and spinal cord, because that's where it affects us, right? Brain, putamen caudate, cerebellum, and the spinal cord is what happens for MSA. They can also release growth factors that nourish and support the survival of existing neurons. Many athletes always, people have been banned and kicked out of leagues, and I remember years ago that playing sports and stuff like baseball, if you have human growth hormone, they consider that like a form of steroid cheating. And what that really was a person that said, "Hey, I tore my Achilles," or my wife who had surgery on her meniscus. They would inject it with human growth hormone or similar things like MSCs, and it would rapidly increase, repair the damage to their body. Well, most of our damage though is coming in the brain, but because the brain, it affects the brain's dying parts of it, it affects the rest of the body. So I also had some treatment of, it's called cerebrolysin. Sorry, cerebrolysin. Um, which is another promising avenue of approach for research for MSA, right? Um, cerebrolizin is a drug derived from pig brain proteins has been for years been used to treat stroke and Alzheimer's diseases. A lot of MSA patients and partners go to stroke rehab centers to recover, to try to improve things. It makes sense. So, but recent studies suggest that it might also have benefits for people with MSA. Cerebrolizin is thought to protect the brain's neurons from damage and promote their repair. While these evidence is still, preliminary, it's not fully, foolproof, proven. Some clinical trials have shown cerebrolizin to slow the progression of MSA and improve cognitive function, something we start to lose very quickly. I also had another drug done with me, which was the ME factor, right? And its effect with MSA. M.E. factor is a unique blend of amino acids and peptides. It's designed to boost the function of mitochondria, the stem cells, right? Mitochondria, the powerhouses of our cells. So in MSA, there's evidence that mitochondrial dysfunction, which means the cells aren't producing enough energy to function properly. Right? I feel great right now. Why? I feel great. Why? Because no doubt ME factor is making my cells work. Not doing anything else to the cells, but making them function, right? Giving them proper, the power, the energy they need to use to actually work. So ME factor helps in restoring energy balance and protect neurons from the damaging effects of mitochondrial dysfunction. In the same people, we have this, no doubt, on top of Parkinson's and some other similar diseases. So, some of these therapies need further research, right? It's important to remember that all these therapies that even I had, the drugs I had, are still in various stages of research, right? There are preliminary findings that are encouraging with these drugs that I've talked about with MSA, but obviously there needs to be more, particularly large-scale clinical trials, which there are some ongoing with Mayo Clinic and around the country and the world, but they need to confirm their safety and effectiveness in humans. But the fact that we have so many promising leads gives us a real hope for the future of MSA. Now, MSA is a challenging disease, but it's not insurmountable. I mean, it's terminal, it's deadly, it hurts. But with continued research in these areas that I've spoken about, we might ultimately get to a cure. And I'm not going to say the word cure very lightly here. What I had done was not a cure. I had a treatment based on information from a very good friend of ours, Miss Walsh, Kelly Walsh, I believe. And it really has helped. First visit, I got IV and a couple of injections. Second visit, I had a spinal injection, not spinal tap, but spinal injection. And third visit, I had another set of IVs with other injections as well into the IV. So the cliff notes are the IVs don't hurt at all. There's really no side effects. The spinal injection I had, which is the most important, because the spinal injection is one of the ways to directly get to pass the blood-brain barrier. I had earlier in Chicago last year, I had other stem cells in August, I believe, and they tried injecting through the nostril, which is another way to get close to the blood-brain barrier and try to cross it. Well, I don't think that really happened because I didn't see any improvement. There was a DAT scan that showed a little improvement on my Pudamin, but also lost my call date. So I'm not going to tell you it helped me last time because I don't think it did. This visit, though, is very different. Everything was certified. The doctor's certification, documentation, everything was legit. Of course, it's not the United States of America. It's a second world country, developing country. So, the standards and the treatments and the buildings and sidewalks and cars and whatever society is not as advanced as like the UK or the United States or Canada. So, when you go down there, you can't expect to have 100% of the normal medical protections and procedures that they do in the U.S. because they just don't do it. It's not the way it is. It's kind of like food safety and driving safety in Mexico. night and day when it comes to the United States and Mexico. But this office was very safe. I enjoyed it very much. It was very good to see them, and I will be including photos of what I had done as I'm cooking through there. But basically, there's two brothers. They're both doctors. They have a facility, a practice they have in Guadalajara, Mexico. Their name is Dr. Carlos. So there's two of them, Dr. Carlos Miramontes. And I can tell you right now, I feel better in a few areas. And this is not for kids. This is not for children. I want to be very honest with you. I'm never gonna lie. I am not the person to say something just to say it, to get clicks or likes or whatever. I don't do this stuff. Okay. I'm showing you my path, what I'm doing the best thing possible. Number one, to let you know my state of mind, when somebody comes up to me and says, David, you have to go try out this restaurant. They have the best food in the world. I don't. I hate when people say, oh, you got to try this. It's so great. You know why? Because when I go there, I don't like it. I'm picky. I'm stringent. I'm an idiot. I'm too protective. I only like certain foods a certain way, and that's the way it is. So when somebody says, oh, this treatment over here does whatever, I don't believe them. What? Trust but verify. I'll nod my head to you. I'll agree with you. If you say eating more corn and vegetables every day makes your body better, okay, cool. But I don't think vegetables and eating corn and fruits and stuff made me get MSA. So, I will nod my head to people and say, okay, that sounds very interesting. I hope it works out, or we'll look into it, But the only reason I went down to Mexico, and we spent, I got to give a little bit of a discount for the third treatment, but in the ballpark of, I think, $6,500 or less. And I can tell you for a fact, I have improved in a few ways. Symptom by symptom. The first thing I noticed was the next day. I didn't really notice anything on the first IV, but when I got the spinal injection, I did have horrible headaches and some pains throughout my spine. And the doctor told me that I would expect this. I did not expect it to be that bad. And I would say this was completely different. Like, you remember me talking about other video about my knee pains after walking and running that 5K. This pain was up in the head, the spine, and it was, I would say, worse than the knee pain. I can't believe I would even be saying that right now. But the doctor told me it's like an overpressurization of the brain, because they injected a fluid in me, like 5 milliliters. And they gave me extra, like 7 milliliters, 7 instead of 5. And in the spinal cord, when it goes up to the brain, it creates like an overpressure. Kind of like when you blow a balloon up too much, it pops. So that's what caused my severe headaches. And that lasted for about 2 days. I got over it in about 4. I just got my voice back because I got back to the U.S. and I got over that pain. So now I'm speaking much better. But I noticed right away, immediately, I'm telling you, like 3 hours after that, we took a bus to go see Grandma in Mexico, in Morelia, 3.5 hours away. And I went to the bathroom to go to use bladder, number one, we'll say. And I'm a male. This will probably be the same for women. It's just opposite. I was able to feel myself going pee. When I have MSA, you lose sensations. Things become not necessarily numb, but you don't feel the sensations you usually do, the vivid detail of anything, right? I burned my feet in secondary burns because I couldn't sense the heat. Eventually I did, but not for 20 minutes. Same thing with the cold, right? I'm like very, not frostbitten, but close to frostbitten from my hands because I was in water for a long time and I didn't realize it's cold. So I went to the bathroom on the bus in between. When I urinated, I felt euphoria. I want to say the word climax, and I mean that very intentionally. I had a climax while going to pee on the bus. I had not felt the entire part of my private part for 2 years. Did I feel myself going pee years before? Yes, but not the sensations, not the outer edges of it. right? This is private, but it's important. And I was able to during that bus ride, and subsequently since then, I've been able to feel my bladder before I get full. Before I rush to the bathroom, I'm feeling myself. I'm feeling my bladder again filling up. Now the force and stream of it was slow at the beginning, and now it's picking back up. I'm now having like a very typical urination, so to speak. Um, and I'm able to feel my intestines. I'm able to feel my large intestine. Right, I have voiding disorder on top of this neurogenic bladder. So not only can I feel my bladder, I can feel the entire extremities of my bladder, right, private parts, um, skin, outer skin, inside skin. I feel it, but I also feel my stomach filling up with food. Subsequent nights since then, the more we ate in Mexico, tacos or whatever, I can feel myself getting full. Right, I got it. Or I have to go to the bathroom as well. So not only do I feel myself getting full now, but I also feel myself having to go to the bathroom, going in this case number two. And it's important to know that I can now not totally void number two correctly, but for the most part I can. The first time I went to the bathroom number two, I took so much pain medicine because that shot to my spinal cord hurt so bad in the brain. I was so constipated. I took so much medicine. So the first one don't count because I was constipated from all the codeine, all the Tylenol, right? A lot of pain meds. But after that first one that I got cleared away, I was able to go. I was able to go easily to the bathroom. Do I still have issues? So I still have slight issues with stopping urination and not leaking, and stopping voiding. Number two, with leaking too. So the very ends of those muscles, stopping pee and stopping poop, I still have a little issues with. But I can properly go number two now and not have to worry about in between. I can feel myself just like number one, going number one. On the same subject of the private part, which is very important to speak about, I now have sensations. Just like going pee, going poop, feeling the total intestines, feeling like you normally do. I have arousals. Random. You see a pretty girl, you see a pretty boy, man or woman, a cool sign, Selma Hayek, my wife. You're supposed to be excited, aroused. I do now. I haven't had that for about 2.5 years. I can remember. I could go back probably 4 years with erectile dysfunction, and I mean that in every sentence. I can go back at least 4 years. I know the exact day and time. I was like, something's wrong here. It's not working. And since the treatments, halfway through them passed, I was going, like, wow. I'm like, this is crazy. Like, when's the last time you had an arousal in respect to ED? It's been a long time. Oh, you're supposed to have nocturnal dreams, with ED and stuff like that. I haven't had that forever. I rarely got that. I think 2 times in the last year have woken up with nocturnal ED arousals. So it's been a long time. That's important. It's funny for me to say that. It's embarrassing, but it's important because it's a part of satisfaction. It's a part of being happy. It's a part of being satisfied. And most of MSA, we're not, because we can't use our body. We don't have sensations. We have ED. We have low testosterone, whatever. And to get that feeling, that sensation, those sensations back is great. I'm not going to go too far with this next statement. When you have ED and MSA, you start to give up on sex. It's tough. It's tough. It's tough. Nobody talks about that. Nobody really wants to be with somebody who can't perform. I understand. And for us with MSA, man or woman, I can only speak for men, by the way, it gets embarrassing when you cannot perform. It gets embarrassing when you can't keep in motion for more than 3 seconds. So when I say very lightly and heartily, um, that part of my life has increased too, improved as well. Is it perfect? No. I haven't tried so much because of a lot of issues since then. Right? So coming back and anxiety, bodies is flipping out. But that has improved too. From nothing, I would say to 20, 30%. You know what I'm talking about. And I just started trying again. This is giving me the opportunity to try. It's working. The question is, how much more is it going to work? It's important to talk about facts, and that is one of them. The other thing I noticed was going on. My head's not spinning anymore. I'm not dizzy. I've only been busy 2 times since then. And that's because I was bent over to the ground, picking something up, and I came all the way back up real quickly. I got a slight dizzy and went away, like normal people would do. My head is not spinning anymore. My vision is not spinning. Neurogenic orthostatic hypotension. I'm not sure, I don't know if it corrected it. I'm not spinning anymore. Hallelujah. I'm walking in airports and stuff. I'm looking over my shoulder and not falling, not getting dizzy. I'm going down, picking stuff up, playing my cats and, computers, whatever. And I'm looking up and stuff. I'm doing great. I'm not spinning anymore. I can actually try to do things now without worrying about passing, well, for the most part, passing out and, spinning and falling. Right before this, I was typing it into Gemini to give me some ideas on the speech. I typed a paragraph to Gemini with only 2 mistakes. I am typing very well right now. Hands on, doesn't seem like it. I typed a paragraph quickly. I'm going to say 140 words per minute like before, but maybe 60 or 70 words per minute, very quickly with 2 backspace. I had backspace two times. Thank you. My hands are moving properly. Fine motor skills. Is it perfect? No, because again, look at my fingers. Before my left hand, I could not do that. My right hand is better, right? You reverse it. Left hand is still restricted, but it's moving. I mean, fine motor skills. It works. Other issues. Now, I did notice a little bit of deep breathing afterwards, a few days. Very deep breaths I never had before, but we'll ignore that. Not sure what that is. But for the most part, even walking, after the spinal injection, my wife saw me a few times. She said, "You're walking better." And I was. The problem in Mexico is the sidewalks and streets, and it sucks to walk on. It's not a developed country like the U.S. Sidewalks are nice in the U.S. for the most part, most of them. Mexico, none of them are, unless you're in the rich area, right? So I took my basketball shoes to walk in because they were wide and stiff. So I didn't have my running shoes I normally use to walk in. So walking in Mexico was harder to do because of the streets. There's holes everywhere, cobblestone, horrible sidewalks. I'll send you pictures. Everyone knows when you go to Mexico. If you're outside the tourist area, it's horrible. But when I come back, my wife still saw me walking much better, more fluidly, without falling, tipping, or anything like while we're in Mexico. And now when I'm back here in my house, more relaxed and walking on my feet so far in shoes, house slippers, I'm walking much better. Much better. I feel so great now. I want to go. I want to go run. I want to test the sucker out, which is very fascinating. So, those are the things so far I've noticed I can definitely tell you for a fact are because of the stem cell treatments I had. Absolutely because of it. There's other things I think improved as well, but I'm not sure. I'm waiting for a few days or a week to make sure it's related to that. I'm making sure. I'm not going to lie to you and tell you. I did not believe this until I saw Kelly Walsh on our podcast. We saw her the first time. We saw her subsequently 4 or 5, 6 months later after she has some. She says she's going to Mexico for stem cell treatment. She came back on our podcast, MSA Crusaders. Check us out. I did not believe it because we recorded video, but only sent you audio for now. And I saw her first video, and she came back on a second person, and she was a completely different person. She was glowing with color, vibrancy, her hair, her eyes, her skin. Because the treatments they give us affects your skin, makes your skin better too, whether you know it or not. She was talking much better, looking much better, moving much better. And I saw her second video that we have, which I won't ever post unless she says so. But I was like, wow, that's what Daisy I said. Did you see night and day? And that was like 4, 5, 6 months. And we've had some other people on twice, and 5, 6 months they go from being okay to being really bad. I would never sell you on something that's not true. I'm not a medical doctor. I would not give medical advice. I'm just stating facts and medical opinion. It's up to you if you want to do these things. But there is no cure. Still going to die as far as I know. But if we can make some of this a little bit better to the end, great. If I can keep my voice and my speech and some motor skills, right, and some intimacy with my wife, life gets much better in the house. Your family's not frustrated because they have to do everything for you. I'm cutting my own food after the spinal injection. I'm cutting my own food in Mexico. My wife normally cuts all my food. Swallowing has gotten much better, much better. We went to a restaurant. I bought the wrong. I said small, half portion. They bring out a whole salmon, 2 salads, and like 24 coconut shrimp, shrimp. And coconut shrimp is not what you want when you have MSA. When you aspirate things into your lungs, or when you choke on them because your throat esophagus don't work. That's not what you want. And yet I ate like all but 2 or 3. My wife didn't steal one. I gave her one. I had 2 left over. I must have ate like 15 shrimp, coconut shrimp. And I swallowed large pieces on accident. And it went down perfectly. If that was before the stem cells, I would have choked to death on it. And to be very honest, I asked my wife, how many times have I choked since the treatment? She said twice. And they both were on that dinner. Only choked twice. It was very minimal. One was a choking, normal choking, and one was an aspiration. One piece of the coconut got in there, right? Coconut shrimp is not what you want to eat if you're an MSA patient. Coconut shrimp is no good for you. And yet I was so comfortable eating, I did. Salads, grapes, I tried them all. Normally things I would not try because if somehow they find a way to get it where we're not supposed to. It's worked. The question is how long? It's not a cure. It's worked. Listen to my voice right now. How clear am I? Clearer, more clear. I'm enunciating more properly. I'm speaking faster, but also maintaining my voice. I'm not slurring as much right now. Look at this video and look at my last one. I don't know if I look better. Pretty ugly. But I feel myself, I sound better. I feel better. Is it a cure? No. Do I recommend it? At this point, if you can take the headache pain that was excruciating for me, which may not happen to you. I don't know if Kelly Walsh had that. We're going to have to ask her. If you can take that, absolutely. And of course, the resources to pay for it. But today is a new day. And, he said if it feels better, come back 5, 6 months. And if not, or 3 to 4, it just depends, right? And it's hard to take a doctor's word, take him at his word in another country that you don't know, and where if you look at his website, it looks like a abandoned house or something. Not quite that bad, but it looks like a poor house in Mexico. But it's not. That's how Mexico is. You got money or you don't, and very few people got money in Mexico. So when you see houses and businesses and doctors' offices, it's not like America where they have their own doctor's office in the middle, a separate building on its own corner inside the street. Mexico, everything's together. Houses side by side are turned into medical office, a panaderia, a carniceria, and a liquor store. That's how it is in Mexico. That's life. So you gotta remember that it's a different way of living down there, but they have all the certification. It looked legit. It seemed legit. It was clean. It was proper. They did everything by the book. They did the small injection was a little bit different than we do, but they still did it. And I couldn't be more happier right now. I couldn't. Even Daisy last night on the phone, I thought I was talking badly. She said, "You sound so much better. You sound so much more clear." And I can hear it right now. I do. I do. I do. I do. No, I don't think I got my vocal cord back because I still was speaking. I can feel it speaking on my right side, but I'm doing better. Fine motor skills controls the whole body. So again, I'm going to post this tomorrow. Also, when we post our podcast, if you have questions, text me. I'll post the pictures or links to the website or to their office location. And please, again, don't take my word for it. Take everything I said with a grain of salt because you don't know me, right? I don't expect anyone to believe me. This is not clickbait. If you watch my videos, listen to me and listen to me now. Look at my movements. Look at my even hands and gestures and stuff. You will see there's a big difference. Proof is in the pudding, and I'm not pudding, but here I am. So I appreciate you. Stay strong. Stay MSA strong. And there will be another video because this is awesome, and I feel so great. Thank you very much.